Welcome back. It's been nearly 3 years since the launch of the nationwide 988 Suicide and Crisis Lifeline. Elise Preston reports on the understaffing and underfunding threatening to upend the hotline's mission. And a warning, this package does discuss suicide and self-harm.
Just a phone call away.
Suicide Prevention Center Crisis Line.
The nation's 988 hotline works like 911, bringing critical access to care for those battling mental health emergencies. Counselor Alejandra Varga takes calls at Didi Hirsch in Los Angeles, the nation's largest suicide prevention center.
How did you get into this work?
I know what it's like to go through this and not feel comfortable reaching out.
As a teen, Varga was diagnosed with cancer and spiraled in despair.
What did it feel like navigating that space?
Overwhelming, numb.
20,000 calls and texts a month at this call center alone. Nationwide, calls increased 40% soon after the memorable 3-digit number was officially launched in 2022. Didi Hirsch CEO Lynn Morris.
Since 2022, 12 million people have contacted 988.
Sometimes this is a life or death situation.
Absolutely, it very much can be. So we have dealt with people calling our line who have either taken measures to end their life or are sitting at home with a gun in their lap.
A new study outlines that while calls have gone up, access to care after those initial calls has not increased. Its authors are pushing for more awareness and funding to make 988 more effective for those in need.
There aren't enough resources. There aren't enough therapists.
1 in 4 adults in the U.S. lives with a diagnosable mental illness, but many more could be struggling without a diagnosis, and the numbers are expected to go up. Meanwhile, public health services nationwide could face federal cuts.
If you don't get those steady resources, what does our community look like a year from now, 5 years from now?
I think it would be a very dire situation, to be honest. There would be more hospitalizations, more deaths, and ultimately more mental health issues.
Varga, that once struggling teen turned counselor, promises to be on the other end.
When someone calls suicide prevention, they're already breaking through a lot of barriers and a lot of stigma. So there is vulnerability and courage in those first few moments of contact. It's those moments where you show someone, I'm glad you called.
Elise Preston, CBS News, Los Angeles.